I trusted that hospital. They let Lacey down.
Nadine Lont was due to give birth to a healthy baby girl last year when her placenta ruptured. She writhed in pain for hours at Latrobe Regional Hospital, but says her screams were ignored and she wasn't taken seriously.
There was no urgency, there was nothing, but Lace was in distress the whole time.
Lacey was born unresponsive and with brain damage, and after a week of seizures, her mother made the heart-wrenching decision to turn off her life support.
And now I'm just awaiting the outcome of why my baby was left to slowly dying in me.
Latrobe Regional Hospital is one of the biggest in regional Victoria and has attracted hundreds of millions of dollars in funding for upgrades in recent years. But behind the scenes, the ABC has been told of concerns about how the hospital is run, citing a number of near misses and adverse outcomes for patients. Lacey's death was classified as a sentinel event, which involves a death or severe injury as a result of adverse care. She was one of 3 child deaths at the hospital in 6 weeks and one of 9 sentinel events in the last 5 years. In 2022, Jessica Merritt's 8-month-old son Finley became unwell. He tested positive for COVID, but while his parents noticed his condition deteriorating, no further tests were carried out and he was sent home.
He just let out this high-pitched, raspy scream and you could tell that he was in agony.
They followed their gut instinct and went to Bensdale Hospital, almost 2 hours away, where Finley was diagnosed with bacterial meningitis and sepsis. He now lives with a disability. Finley's treatment was not classified as a sentinel event, but after hearing of other cases, his parents want action.
When I heard that there were others, I realised that this is clearly an issue and, I want to make sure that it doesn't happen to anyone else.
While Lacey and Finley's cases are isolated, staff have told the ABC they point to broader systemic issues at the hospital, saying education isn't properly offered, funded or valued. Latrobe Regional Hospital rejects the claims and says training for nurses and medical staff is generally delivered in line with their employment agreements. Anaesthetist Andrew Green left a year ago after his recommendations for improved patient care were ignored. He says staff are burnt out.
The effects on the quality of work they do results in effects on the patients and the other people they're working with as well.
The 9 sentinel events have been investigated by Safer Care Victoria, a state government body that bases its investigations solely on the hospital's notes. Staff and patients, including Nadine Lont, have told the ABC that's not good enough.
I want patients to be listened to and advocated for, because all I knew in that moment was to scream for my life and beg for them to get her out, but it just fell on deaf ears.
She wants her case independently reviewed and has called for a coronial inquest. Symons, ABC News.